Hi, my name's Nicole Jones. I'm based at Exercise for Less at Fish Ponds, Bristol. I'm part of the Physio crew and I'd like to talk to you today about concussion. Concussion is something that lots of people ask me about, and I see day to day with the rugby girls at the Bristol Women's Premiership side. I cover their pitch side course, and I've done previous ISIS training, which gives you sort of a high level of training in pitch side care, looking at concussion, looking at sports injuries. So really today we want to try and get the message out about this idea of concussion and what we should be doing. So the RFU have provided a fantastic resource called Head Case, and if you ever want to know a bit more about concussion, which we all should really, is go onto that site, look on Google, type in Head Case, and it'll take you straight through. As a parent, you should know these things really, because sometimes there won't be a pitch side first aider there, and again in the local area I'm really trying to drive courses at the moment to increase the knowledge on concussion, because we're not doing it right at the moment and we need more education and more knowledge in this area. Look out for some local talks. I'm going to try and do a few of those as well. So the really important things that we need to remember are these sort of 4 R's, and that's the key one is recognising. If you can recognise the person has a concussion, then you understand that they need to be removed from play. So no questions about it. If you suspect a concussion, they need to be removed. Then we're looking at the recovery aspect, allowing the brain time to recover, and then actually returning to play in a very graded way, not just going straight back into it, but actually gradedly exposing yourself to more exercise and seeing how the brain reacts and whether you can cope and fully return. We need to change attitudes. It's the old attitude of, oh well, you've got to be, really spaced out and you just go back the next week. It's changing. We're realising that actually the brain needs more time than that to recover, and we can't be messing with our brains. Okay, if we injured a muscle, we wouldn't be then just lifting lots of weights on it. It's the same with the brain. If you're concussed, the brain has a short period where it's got impaired function. We had a case last year where I saw a girl and she was knocked out. 10, 15 minutes later, she was talking to me completely normally. She was still knocked out. That is still a concussion, and we have to treat these with respect. You only have one brain. What I'd like to talk to you today about recognising it. So if you were suspecting, you went over to somebody and you were unsure if they were concussed, if you go over to them and they can't answer you normally, they're not sort of saying, oh, my pain is here and this is what happened. If they can't answer you normally and they've had a hit to the head, they have concussion. That's it. You need to remove them from play. Anyone whose brain is functioning normally will be able to say to you, oh, this is where my pain is. Signs, again, we're looking for are they dizzy? Are they answering appropriately? We have something called the Maddox questions. So we ask them, who is your opposing team? Who scored last? Where are we today? What date is it? We modify these for children, because they find it more difficult. What is the time to the nearest hour? So these are some things that we can change. Baseline testing is very important here. So we use something called a SCAT test. This is only helpful if you have a baseline score. So we can do it before the season, and then if the person has a head injury, then we can look, or concussion, then we can look and we can compare and see if they're the same or if they're different. And this helps to guide us in the return to play. At the Physio crew, we do free SCAT testing here. So if you want to have a baseline for your child or for yourself that you can look back on, that is a very, very valuable resource to gauge how bad your concussion is or was. Again, looking at signs and symptoms. Are they dizzy? Have they got a headache? Are they sort of acting inappropriately? Are they laughing? Are they crying? Strange emotions are very common when we have concussion. Are they feeling like they can't see properly, or there's blurred, or there's double vision? The danger is that if you have a second impact of the head within this short space of time, it can be very, very serious, and we don't want to go down that route. It's much better to be safe and remove them than for them to carry on and then have a second impact which could result in a fit. If you're unsure about the person, if you feel that they may have had a neck injury at the same time, don't move them, particularly if they've got pins and needles and numbness in both of their hands. Leave them and allow the pitch side first aider to come on, or call call an ambulance. Looking after the game, what you want to be looking for is making sure that they've got the right management. So we'd always recommend that they go down to their local minor injuries unit, A&E, or call an ambulance if they're deteriorating and we're worried about them getting worse. That first 24 to 48 hours is key. In that time, if they're going to deteriorate, it's going to be within that time. So we want to be monitoring them. Do they have problems with their speech and swallowing? Is it getting worse? Is the headache getting worse? Are they becoming uncoordinated or finding it difficult to balance? Concussion can be very subtle. It can just be, they can seem fine when they're talking to you, but when you ask them to stand on one leg, they can't control their balance, particularly if they close their eyes. In the local area, we're doing a big drive for this, and please look out for courses. We're looking at trying to improve the knowledge of concussion and change attitudes and values away from this kind of, oh, we'll just deal with it, and actually getting people to recognise that it's a significant injury, and we don't want to be pushing people into a stage where they could become seriously harmed or long-term harmed. It's been great talking to you today. It's nice to meet you all. It's my first video, but there will be more. So the next video we're going to be looking at sort of the SCAT testing in a little bit more detail and how that helps us, and then looking into how we recover and then how we return to play. So today we've covered recognising it, realising that it's concussion. They don't need to be all over the place. They just need to have some of those symptoms. Remove them from play so they're safe. Monitor them. If they're getting worse, always make sure that they are seen by a medical practitioner, and next time we'll move on and we'll look at how we look at recovery and return to play. Nice to meet you all. Bye bye.